So let's call this meeting to order for Tuesday, June 10th.
Kay Wilson,
Here.
Tweed Schuman, Marshall Savitsky,
Here.
Chuck Van Etten, Jeff Haney,
Here.
Bill Trepanier, Don Pettit,
Here.
Carol Pearson, Dr. Dunlap. You have a quorum.
Good. All right, let's say the Pledge of Allegiance. Pledge
Allegiance to the flag,
the United States
States of America, to the republic, stands under God, indivisible, with liberty and justice for all.
Do we have certification of open meeting?
This meeting was noticed to the media and the public as required by Section 19.84 of the Wisconsin statutes.
Thank you. We have an agenda. Any additions or corrections? Set. Any public comment? All right. How about approval of the minutes from April 8th?
I would make that motion.
I'll second it.
Motion's been made and seconded to approve the minutes from April. Any further discussion? All in favor?
Aye.
Opposed? So carried. And I need to apologize for the faux pas of May. We didn't have a quorum, so we couldn't have a meeting and we should have gone home. So now I know the rules. And you can't be a substitute. Okay. So do we have any information from LCO?
Tonight they're having a community event for Falcon, which again is the fentanyl awareness campaign. And the other update I have for them is their grand opening of their new health, community health building, health center. And that is going to be this Friday, June 13th from 2 to 5. So if anybody wants to go over and see their beautiful building, it actually is very lovely. They're going to do a feather pole raising at 11 a.m. And then at 2 p.m., they're going to have a welcome and an opening prayer, some songs, color guard, drum groups, and guided tours. So that is going to be a big event for them. And that is all I have for that.
Do we have anything for the Senior Resource Center?
No.
All right.
Are you on it now?
I know we had a rummage sale planned for the end of the month. It's going to be at the Sawyer County Fairgrounds in that building, I believe. I think it's the last Monday of the month, I believe. Other than that, nothing
I
else.
don't have that.
All right. Administration.
Okay, I'm actually going to just bring up a PowerPoint here just to, I'm going to just replace the current share. Back up here. Okay, some of these were slightly discussed last time, but being that it wasn't a quorum and we don't have meeting minutes of that, I'm just going to go over a couple of things. Carrie had mentioned that all our staff are now using Time Clock Plus, that is our time tracking. Before we had some people on that and some people on our Nightingale Notes system, and it just caused, because we're actually going to be going to the new EHR, we needed to get people off. And the other thing that we found is that it's really reducing time in entering our times and streamlining our reporting. So happy that that's all transitioned. And then Carrie reported out on the new electronic health record that we'll be getting. Our current system is outdated. We've talked about this at some meetings in the past and needing to make some upgrades. We're still using some paper charts, some things are in files, some things are in the medical record, but it just is not up to what we need for auditing purposes, as well as just getting everybody in the same system. We obtained a grant to help cover those onboarding costs of getting the new one up and running. And then once that's up and running this year, then it'll be the same costs basically that we're already paying on our old system, but received a grant, so we don't have to worry about going over budget on that. And we plan on getting that implemented, hopefully starting sometime in the summer, fall. We want to have everything up and running so that we can have good, strong billing when we transition in January. So we had that all-staff meeting on June 4th at the Wesleyan Church in Hayward. We covered topics of how counties work, and we introduced Mike to everybody. And, you know, I gave them an opportunity to ask them whatever questions they wanted, and it was silent. I can't believe that. So that was great. He came on board. We also went over the Green Book, and you guys received that from, what's the company that's going to be helping you? They came to your Forward Analytics. Thank you. So we went over some of the statistics in the Green Book to help everybody really be on board and understanding really what's happening in Sawyer County and projections. We had our employee assistance program, Bill Dursup came. I can't remember his last name. I'm looking at you, but you weren't there anymore. He came to really explain the employee assistance program, which was really good because I think a lot of people still think of these programs as things that you work on when you're having problems at work, when really this is an amazing program that will help people have professional development and then things that are happening in their personal life. If you just need some assistance quickly and on a short period of time, it's a great program. So I'm hoping that we start seeing more people getting involved in using that. We talked about workplace safety. We introduced a new fleet vehicle policy. We had medical release updates. We talked about time card clocking, time off discussions, and then we had discussions on conflict of interest. Something I know you guys are starting to do with the board of supervisors and kind of filling out and understanding conflict of interest with your policy. We don't have one really in HHS, so that'll be something that we're going to be developing and having a questionnaire. It's something that I used to do when I worked at the hospital, and it seems like it's something that it would be really good for our staff to do, and it'll help guide us when we need to get that additional assistance or ask another county for assistance when we need to step away and ask a supervisor to step in. So, and especially in the work we do with ethics and boundaries, sometimes we get a little bit too invested in our work, and when is it that we just need to step back? So that was a really good discussion. Any questions before I move on? Okay. We are starting to track walk-in traffic because we definitely have noticed an increase in people just coming in for services rather than scheduling appointments. So just to get a number, start to give you a number and a feel of how many people, and this is coming into the courthouse office. I don't have the numbers for the ADRC this month, but we'll be getting those. Some staffing updates. The ADRC and Long-Term Care Division, Rebecca Erickson started in mid-May as our Adult Protective Services worker. Hank Norris, I had mentioned before that he's retiring from the Elder Benefits Specialist position. That will be the end of June. And Shannon Ewert is transitioning from Youth Justice to the Elder Benefits Specialist position. So we will be fully staffed by the end of June in the ADRC Long-Term Care Division. Child Protective Services, we have an opening for a family services facilitator. Those interviews have been completed, so hoping to be able to fill that position very soon. Youth Justice, I know that Sarah's going to talk about this, but Melinda Oyes has started, did I say her last name right? Oyos, thank you. I knew I wasn't going to get it right. Started yesterday, actually, for the Youth Justice Diversion and Truancy Worker, and we'll be posting for the Youth Justice Worker position. In environmental health, we had interviews completed for that limited term position that was approved with the TRH ordinance. That work is definitely getting boosted up right now. So hoping that we'll be able to fill that position. And then the other position we have open in behavioral health is the mental health counselor. So we're starting to get, I don't even want to say that too loud, but starting to get looking a little bit better in the amount of people applying for the jobs that we have. So that's been great. Finally, our next steps, we're working with the supervisors to finalize the budgets. At our next HHS board meeting, if you'll recall last year, I did that whole report on the budget. We have to have a public comment period. So that we will put on the agenda for next time, and we'll start that and be able to give people time to come in. So typically what we'll do is we'll do the public comment period specifically for the budget, and then we'll go into our meeting. So that's a requirement from the state that we have to do that. The other thing we've been working on is updating the organizational chart to reflect what actually happens within each division, so that you can better understand the work, and actually even getting new employees in and helping them be able to understand who does what, where, not necessarily like who does it, but what happens in that department, what happens in that division, I think that'll be helpful for you guys too, as I talk about these different areas, to not only know the people that are in them, but actually understand the different types of work that gets done in them. And then the other thing that we're doing is developing a centralized referral process. And we want to do that so that we can ensure that customers are actually reaching the right resources at the right time. So sometimes it's real easy if you only get to one person and they ask all the questions just about a particular area and they're not thinking globally along all of HHS, we might miss making a referral to some resource that would have been very beneficial. So those are the next steps that we're working on. So any questions with that?
Are we going to be able to see the proposed budget before the meeting then?
That'll come out with
With our, okay.
Usually what we had done, I think we emailed kind of more of the real specifics to this group. And then we have a little bigger summary that we do out on the public, just so that you can kind of see where those go. Okay, that is, and I always turn over to the administrator. Do you have anything additional to add?
I took all of these papers. Do you need any of your papers?
No, I'm okay.
Okay.
No, it was just fun for me to go and see everybody at your training. Being in the courthouse, we don't get to see everybody from other departments very often, so it's always good to kind of put names with the faces. So I enjoyed that. Thank you for inviting me.
And putting you in the hot seat. Okay. Shall we move on?
Behavioral health?
Aging and disability.
Oh, I'm sorry.
Yeah, it's just a small spot. And I have just a couple of things to update on. Carol just got back from a nice long vacation, but she's been very busy actually training in APS, either covering for additional adult protective services and or training in. So she's been kind of doing multiple duties there, plus looking for the new EBS worker and kind of filling in there and transitioning. So it's been quite busy over there. But moving in the right direction. And then the other piece that I was asked to bring up and share is our dementia specialist is working with let's see if I can see it, is working with our caregiver network to present on Thursday, July 31st. They're from 2:30 to 5 at LCO University. It's Wine, Women, and Dementia. And it's really talking about resources, sharing experiences with those that are caregiving for dementia, and also, helping people get in and get tested early on. So it is a no alcohol wine, women, and dementia. It'll be mocktails. So that's going to be happening, and it's actually a production. It's a movie that will be shown. So That's that piece. So that really ends that report there. Oh, one other thing. It sounded like last month there was some information and data that was shared within the ADRC. There was projections on disability and whatnot. That information you had questions on, I'm going to have Carol come in the next meeting and we'll bring it back because it seemed like you might have had some questions that Carrie couldn't answer.
I don't remember.
Okay. Okay, that's it on that. Behavioral health report. I should probably get to that. I don't think there was anything outstanding in that report to pull out. Alicia had a pretty comprehensive report. If anybody has any questions, let me know. Okay, and then, and I don't think we have Alicia. She's actually has been at training. The next in the behavioral health is the community support program and mobile crisis.
Hello, everybody. So for mobile crisis in April, we just got 5 phone calls. Each call, we did a mental health assessment with them. So 2 emergency detentions, and unfortunately, both of those emergency detentions were placements at Winnebago. But 2 other assessments resulted in voluntary inpatient treatment, and then 1 we were able to defer to other services. And then in April for CSP, we had 47 clients that month. 14 of those were court ordered. 1 person discharged from the program in April. Our staffing is about the same. 14 folks were in placements. The rest of the CSP consumers are in homes and living independently. So not a lot of changes on that front either.
Thanks, Caitlin. One of the things, just to make sure we're all on the same page when we talk about placements, when they're placed involuntarily at Winnebago, then that's our coverage. But if when she goes and she does the assessments, if they become voluntary, then that can get covered under their insurance premium and followed that way. So it's always great when we can have the voluntary happen. And one of the placements is still in Winnebago. So I think that was April, right? Or maybe that's the May one. We have we've pretty consistently had somebody in Winnebago. So I'm hoping that that will be discharging fairly soon. Then we have oh, go ahead. Did you have something else you wanted to add, Caitlin? Oh.
Nope, that was it. Sorry.
Okay. Okay, then our typical mental health monthly expense report. Nothing too much standing out there. That's not what we've already talked about. And then actually, Carrie and I forgot to put this on some of the next steps. When we move on to the mental health cost by client report and thinking about alternatives for placements and what are some options that we can do, we have somebody that's actually reached out to us looking at potentially starting a CBRF or a group home. And we're really looking at what our needs are and hoping to build something in the right direction that may help to reduce some of the costs, or looking at some clients that we know are going to need to be moving into these areas. As you can see, we do have some pretty high expenses when it comes to placement costs. One of the things I'll be asking Mike to help with this year as we move forward is I really would like to put a request for proposal out there to see if we can get some some either lower costs and or get them closer to our area, because that's also the other issue is people are so far away and we can't lay eyes on frequently enough to really determine what's happening with that care. So That's the proposal with that. Any questions on mental health or any of the behavioral health? Okay.
Let's move on to children, youth, and family services.
Hello. So my reports are submitted, pretty self-explanatory. I did work on kind of rewording some areas and cutting out things that were maybe too much information, and I just simplified it a little bit this last time. As Julia mentioned, we have the new truancy diversion worker who started today, Melinda Hoyos, and well, she didn't start today, she started Monday, but from what I can tell so far, she's going to be a great fit. She's very passionate and motivated, excited to start to do some change that she has recognized as being a need in our community. So we're very excited to have her. So in the truancy program, we started out this year with first addressing our 10-day drops from schools. So again, the 10-day drops are when kids do not show up consecutively for 10 days. They're automatically dropped from school. And in doing that, it was a bit challenging with not having our truancy worker fully on board until just this week. But we were able to utilize our contracted program, Sorona Recovery, that is also funded through one of our grants. And working between myself and their workers, we were able to get 7 of those referrals nailed down. We were either able to get those youth back enrolled in school. There's a couple that are going to the Challenge Academy. There is, I believe, one that is doing the Job Corps, and then there's one who is signing up for virtual school. So we are making strides in the right direction, and I think this is only the beginning of what we're going to see. We monitor these kids for a period of 1 year, so we will be with them in the fall and through the end of the next school year.
You need,
We have seen an uptick in our kiddos that struggle with their mental health. And what we're seeing is, unfortunately, there's very limited avenues that these kiddos are able to take to get that higher level of care, being like whether it's the 37-day inpatient assessment or if it's a residential facility. All of those kind of placements have to come through the county, which is unfortunate because that comes through the means of youth justice, and then they have to go through court. And when we go through court, we're only asking for a JIPS rather than to find them delinquent or anything like that. But a JIPS is a juvenile in need of protection or services. And so to get those higher level of care, we have to go through the court process to have that court order. The other piece to consider when we start seeing some of this is that is raising our costs in like our youth justice budget and whatnot. So while it felt kind of exciting this year to get our delinquency more under control, it feels like this is the year that we're going to have a lot of these JIPS type cases where there's additional significant needs. So Julie and I are in discussion about what that looks like. I'm working on making more of a breakdown of the different out-of-home costs, whether that be delinquency or whether that be JIPS, and just kind of the trajectory of those youth in placement and when they're suspected to discharge, or if we anticipate this being a youth that will age out of the system, meaning they're in and working with us until they turn 18 years old. So more to come on that. I'm hoping to have that ready to share by our next meeting next month. The other piece that I was going to share, this is kind of more of the breakdown, which is a newer report for this month. This breaks down the total number of referrals that we have received, their ages, We've completed 6, not 7, my apologies. And we have 7 that we still need to schedule intakes on. It breaks down who the referring source was, and then other referral for services that we have sent out in combination with our program. And as I mentioned, the different routes that our youth have taken in being able to obtain that HSED and get their high school diploma.
Speaking about that, you forgot to celebrate.
Yeah, I seen it quickly, but then
Yeah, you just jumped around. Do you need it back? Do you remember your
I
number?
do, because I don't remember the total number.
On the Youth Justice Report.
So this is on the Youth Justice Report, and I wanted to do a little bit of a celebration in the youth that we have worked with, the youth that graduated in 2024 and the youth that graduated in 2025 with their high school diplomas. We had a total of 8 youth that our department worked with that several of them would not have graduated without our intervention. So I'm very proud of my department and the work that we do. And I just wanted to share that with you all.
Congratulations.
Thank you. Any questions?
I had a question about the truancy. When you evaluated the 10 students, what did you find was the contributing factor to their truancy?
I think there's a lot of contributing factors, but what the main piece is that in the younger years, their foundation wasn't built by the people, whether it be their parents, caregivers, guardians, whoever that was. It wasn't enforced that education is important and that it's not a choice. You need to go. Developing those healthy patterns early is very important to the success of a kid going through school without having truancy. And I'm not saying that's in every single case that we have. Every once in a while, you have a parent that does everything right, and that kid, for whatever reason, will still kind of go into left field and make their own poor choices. I think another thing that we recognize, and it's going to be a struggle, I think, in really beginning to make the difference, see the difference, is a lot of our parents that we work with are significantly addicted to drugs and alcohol, where it's very hard for them to make their children that main priority because they're so immersed in their addiction. And so getting people to also understand we have to begin to heal the parents before they can make their children a priority. So with the contracted program we have with Sorona Recovery, the idea behind that is that they will be in the homes doing more of that family support, and we're hoping a therapy piece as well, and building that relationship and trust with parents where we also want to help you get where you need to go, but ultimately it's that parents' buy-in and choice to want to live their life differently. So I think that's kind of a long explanation, but I think there's always a lot of different dynamics that play into this. And, it could be the kids are staying home and they're smoking marijuana during the day. And it's getting them in through truancy and starting to understand some of those underlying concerns, and then getting them the services they need to help in that area. And by us being able to start working with kids younger than middle school on some of these things, I think that's where we're really going to start to see the difference. I don't want to say that our kids in middle school and high school, it's too late. Middle school, I'd say we still have a chance to get in there and make some differences. It's really hard to change patterns in high school. So being able to get in and work with parents, families, children at that younger age is going to be very helpful for us.
Any other questions?
What are you doing with the ones that you're dropping after 10 days?
It-
What's happening?
Can you repeat it, just
Yeah.
because for anybody who's online, you didn't.
So I'll clarify that. We don't drop them. Yes. And we are advocating to help change that policy, especially with having programs now in place to help support that need. What we, in kind of the process going through this and us learning, why that policy is in place, my understanding is that when kids don't attend for so many days, they're not attending, and then it gets to the point where they're also not graduating. That affects the schools negatively and the funding that they get. And so this was their solution to that problem. I'm hoping we can begin to start new paths.
We should be catching up. We should be catching them before they get to that with the new referral process.
Yes.
Yeah, the 10 days, yeah. So we're getting in there, you know, hopefully at the 5-day type of scenario. We were just talking about that today. What does that truly look like and how does that referral process work so we can get to them before? Like the ones that she's working with now were the 10-day drops.
And they're the ones, and that's why you're seeing about 50-50 on the intakes, because the other half are the parents that don't follow through, will schedule a meeting, then not attend, but then not answer your phone call when you try to reschedule. So those are the pieces I really needed this truancy worker to be here and kind of take that on, because I didn't have the capacity to chase a lot of these parents down for the beginning of the year. So we did what we could with the compliance that we had. And our plan is to really solidify what the referral process looks like, get all stakeholders, community partners on the same page as to what everything looks like, and then really be ready to hit the ground running come fall. Yes.
And I think there's only one other thing I wanted to add as you were talking, and I didn't want to interrupt you, but it had to do with when she was talking about these youth that we're looking at to determine if they're going to age out of the program or what's going to happen. Some of these youth are going to age into our mental health adult services. So getting in and getting some of this work done now hopefully can help us maybe they can just be in community support program with Caitlin's program, be in the community and getting that additional support, but not actually having to be in placement under the county. So that's what we're trying to project these out for the next few years and get the services and support we need now to hopefully reduce the cost later on. Okay, thank you, Sarah. Economic, are we on economic support? I think
For
so.
economic support.
Okay, so I gotta jump through everything here. Okay, so we have Shauna's report here, and I don't believe she is on. Oh, is she on? I didn't see her. Shauna, are you on? No, I don't see her on here. Okay, so, yep, I don't see her on. Okay, so, so her report is here. Ooh, what do we got going on? Who's Mike? Standard report from Shauna here. And so I don't think anything is really standing out in a way that we need to call out, but there is one thing that is not on the report that I wanted to share with you guys. We are part of the Northern Income Maintenance Consortium. And what that is, the number of counties that are involved in that is Ashland, Bayfield, Florence, Forest, Iron, Lincoln, Price, Rusk, Sawyer, Taylor, Vilas, and Wood. So all these counties work together as a consortium to meet our consumers' needs. So we manage call centers, and those call centers get people to the specific areas they need assistance with, whether it be food share, Badger Care, our disability long-term cases, childcare, those types of things. They get handled throughout all of the different counties. And one of the things that we have is we have our every director for human services or health and human services sits on the board. We then can make executive decisions based on what we're seeing. Each county signs a contract that says that you are required to do X, Y, and Z as part of this consortium. What we had been finding was that Forest County was not upholding their end of the contract for the last 1.5 years. and we were not anticipating to see any changes. We did have a meeting with them to ask what their plans were to help them get on track to meet that contract. And we were not satisfied really with the answers. And so the consortium has voted to remove Forest County as of 2026 out of our consortium. What does that mean? That means that Forest County will still get services. We don't want to impact the residents of Forest County in the process, but we do need to have a transition. The state will be stepping in and helping us to make that transition, to make sure that Forest County doesn't lose services. We wouldn't be responsible for that, but they're going to help with that transition plan. And then basically the rest of us will still stay in the consortium. It doesn't cost us any more money to have them not be in the consortium. The money that comes in through the economic support services is based on the number of people within your county and we have an MOE, I forget what that's, that maintenance of effort that we have to maintain with that. Again, Forest wasn't maintaining those pieces, and so we have decided to transition. So that is my update. Any questions on that? It was not an easy decision, but we felt that we needed to protect the rest of the counties.
So I'm still fuzzy on what that meant.
Yeah.
So were there employees that
You have
were
to have
let go?
employees. Yeah, they needed to have employees and continue and contribute their maintenance of effort into the contract, and that wasn't happening. They weren't posting positions. They weren't able to keep positions filled. They were using positions that were there to help support the other departments rather than what they were hired to do. And that impacts the rest of us because that means our consumers have a longer wait time and whatnot. So it needed to be nipped.
But the people of Forest County still have the ability to call.
Yep, they will continue to receive services as normal. They just don't really have much for services like right in Forest County, but they have the call center for now. And then eventually the state steps in and then it will end up costing them more money in the long run, actually, but.
Okay, thank you.
Where is Forest County?
Forest County is up near Iron, Florence. Got the picture? Yeah, kind of up. And it's a very small community up there. So anyways. However, there are a few other counties who have the same type of circumstances that meet their contract obligations. So we can't just say from location, that's the only reason why. Okay, any other questions for me on that? Okay, hearing none, then we'll go into public health report.
Just a couple of things. In response to our community health assessment, we identified personal preparedness as a need for residents in Sawyer County. And this year we're doing efforts with our MRC, which is our Medical Reserve Corps, which is the volunteer arm of public health, as well as our public health staff. We went to the Winter Spring Fling on May 24th, and 378 individuals came to our booth there and received information. So it was very well received and wanted to report out on that. Also, I did want to make note, we are seeing slight increases in enteric disease reporting, as well as tick-borne disease, not uncommon this year. What is a little bit different than in previous years, we are now getting electronic medical record reporting for EM rashes, which is definitive diagnosis for Lyme disease, which we hadn't done in the past. It has always been a reportable condition, but it was based on the clinician and the clinician office to manually report. Now we're getting those from the electronic medical record. So we're getting many more of those reports coming through. So that's kind of contributing, but we're also seeing anaplasmosis and Lyme right now. Again, not unexpected for this time of year or this area in Wisconsin. So any questions? Thank you.
Okay, moving into our fiscal reports. Based on the conversations you've heard, actually with Sarah, and just thinking about where things are with CPS and YJ, I just want, we're going to really be watching those contracted expenses, diving down in and trying to make some projections of where we're going to end up for the year, because we spent a little bit more so far. And if we can tailor, we're going to see what we can tailor back or do differently. And that's the comment that she had made, that we're going to really look at those deep dives. We've been having a number of people going through assessments to determine the best source of care for them. So that also has added to the contracted expenses. That's the area that I am picking out on here, as far as for the fiscal report, what we want to keep an eye on. I'll also want to keep an eye on the Winnebago expenses, and see where that all plays out. It is looking favorable that we will get a discharge fairly soon. So, and as long as we keep on that projection, we should be on mark for where we're going with our out-of-home or our mental health placements. So unpredictable. But that's what I have for that. And then, well, I don't have anything else in there. Anybody have any questions?
I guess one thing I'd comment is overall contracted services are right on budget. So the
Well, like
youth stuff is a
overall,
little
yeah.
high, but overall we're doing all right. So we're monitoring it, but not too alarmed yet.
No,
least I'm
but I
not.
got to keep an eye on it.
We gotta keep an eye on it.
Okay.
Purchase services and revenue recap?
Yeah, I just pointed out what I thought you needed to be looking at right now.
Okay. All right. Are there any committee updates from other committees that you're in?
Silence my phone, stayed quiet.
Are there any correspondence or report from conferences and meetings? Okay, we're adjourned.
Okay, thank you.
Thank you very much.